have everybody here today, especially to talk about this very important topic of trauma. I have with me here today Valerie Morrison, and she is going to be talking about trauma and how it affects our students and how we can help support them.
Good morning. Thank you for having me.
Absolutely happy to have you here.
It's nice to see everybody here this morning. So when I was initially asked early in the school year if I would present a little bit of information on trauma, I thought, wow, that's a really large topic. Where do I start? Where do I begin with that? So today I'm hoping to give you kind of an overview of trauma in children and maybe some practical application tips that you can take home and use with your children at home. So let's start by defining trauma. Trauma is described in the dictionary as a deeply distressing or disturbing experience. Well, that leaves it pretty wide open to a lot of different things. 1 in 4 children in the United States have been exposed to a traumatic experience, and these traumatic experience can impact behavior and learning. All right, so let's talk about some examples of trauma, what that might look like. I think we're all can probably identify the most common characteristics of trauma: the physical, sexual, or emotional abuse, neglect. But there's also some other aspects of trauma that might not be so obvious. Poverty is another example of trauma. When kids have to worry about where am I going to get my next meal, or where am I going to lay my head tonight, that can be very traumatic. Household substance abuse, if somebody's in the home abusing substances. Witnessing violence in the home. The mental illness of a household member. Divorce, deportation, or separation of family member. And finally, going through a natural disaster. All these are the most common traumatic events. Obviously, there's many, many more, but these are the most common traumatic events that we do see with children. All right, so what do we know about trauma? We know that trauma physically changes a child's developing brain. So think about if you encounter a bear in the woods. So your body goes into flight or fight mode, and all those hormones surge into your body so that you can escape the bear that's chasing you in the woods. So those stress hormones are helpful at that time. But if that same bear comes home every night from the bar, you have those stress hormones enacted at that time, and they don't disengage. So these children frequently have the stress hormone in their body at all times, and they're hyper vigilant. They're always looking for where the next, what's going to happen next. So they don't have that, the fight or flight is always there. But unlike after we run out of the woods from the bear that's chasing us, and we're able to get that hormone out of our body, these kids that are living in these difficult situations of trauma always have that stress hormone. So it physically impacts their brain. The other thing we know about trauma is that children who've had a trauma in their life often use negative coping mechanisms later in life, like drinking, drugs, overeating, which leads to physical problems. They also have the behavior difficulties in the classroom. Other ways that trauma impacts children is their attention and focus, which are huge components to learning. They have difficulty doing their schoolwork because they're thinking about what's going on at home. Difficulty with memory, again, another huge component of learning. Trauma can increase feelings of anxiety and feeling overwhelmed. They're worrying about the situation that they left at home or what's going on, and they're not feeling safe. Somatization. A lot of these kids that have been through trauma have a lot of physical complaints. Their stomach hurts, they've got a headache, or something like that. We often see these kids in the clinic. They're high flyers in our clinics. Children exposed to trauma have an overreaction to events and people. So they have a much more bigger impact to situations that other kids might not react to. The other thing is trauma impairs relationships. Children may have difficulty trusting other people and may have difficulty interacting with peers. So those are a lot of things that we see in school, but also play out at home as well. So I want to talk a little bit about a study that went on in the 1980s. It's called the Adverse Childhood Experiences, or we called it the ACEs. And it's a screener for traumatic events. And it was initially developed by a doctor in the 1980s. And what he was a medical doctor, and what he was seeing were a lot of his patients were coming in with these physical problems. And when he started questioning the patients, he found out that they had one thing in common. Many of them had these traumatic events occur in childhood. And then he saw that later on, it manifests itself into these physical issues. So he found a direct link between the traumatic events in childhood and adult onset of chronic disease. So this is very important. So it was a study of over 17,000 people, middle class people who had, half of which had a college education. So they're people like us here in this room. And that half were male, half were female. So this is not a study of other people. These are people like us. All right, so let's look at the ACEs a little bit and talk about what it shows us. It shows us that childhood trauma is common. At least 2/3 of the people in the study had at least one adverse childhood experience. And considering that divorce is listed as one of the the ACEs, and divorce rate is at 50%, many of our children have at least one of the ACEs scores. Okay, so then 87% of the 2/3 experience more than one type of trauma. And that kind of shows the interconnectedness of trauma in children. So for example, if there's a child in poverty, may also experience neglect or mental illness. So we see a lot of these adverse childhood traumas interconnected. If you have one, you often have another as well. The other thing we know is that people experience trauma differently. So what may be traumatic for you may not be traumatic for me. So everybody is a little bit different in how they experience these things. And the other thing we know is that the higher your ACEs score is, the higher risk you are at physical and social emotional difficulties. All right, so I just want to pass out the ACEs for you all to have here. This is what the ACEs looks like. And again, this is based on the most common traumatic events that we discussed earlier: physical, emotional abuse and neglect, divorce, and that type of thing. So this is what the ACEs looks like. And again, the higher your score, the higher risk you are of health and social and emotional problems. But good news, kids are resilient, and resilience can be taught. So there's help for kids who may have experienced a trauma, and the good news is that the earlier we have intervention for these kids, the better the outcomes. All right, so how do we build resilience in children? The first thing I want to talk about is no more lawnmower parents. So we used to talk about the helicopter parents and the parents that hover over the child and are with them all the time. So the lawnmower parent is a little bit more intense. This is the parent that just mows over everything, mows over all the obstacles for their child, gets everything out of the way so that their child will never experience any kind of frustration or difficulties. That's not good for kids. Those frustrations and difficulties help kids grow and learn, and helps them with their problem-solving skills. So when we take away kids' obstacles, we're taking away their ability to think for themselves and to problem solve. And it also conveys the message that you don't have confidence in your child and their ability to do things themselves. The second thing we want to remember, it's okay for kids to struggle and to figure things out. Kind of what I was just talking about earlier. It's okay for them to experience some frustration. That's how they learn. So increase your child's feeling of competence. Let them know that you have confidence in them, and it's okay to make mistakes. Saying things like, you can do this. It may not be how you want things to be done, but it gives them a feeling of independence. All right. So other ways to build resilience is give your child expectations and chores at home. This helps your child learn that the world doesn't revolve around them, and that they have a role to play, and that people depend on them. I feel like every child that's 2 years old and up needs to have a chore. A 2-year-old is certainly capable of picking up his own toys afterwards, after he's done playing. So give your child a chore. Give them an expectation as part of being in the family. Give your child control. Let them make their own decisions. Obviously, you're not gonna let them make big decisions, but they can make smaller decisions. And through this, they recognize that they have control over the outcomes of their decision. It helps them realize that life events are not random, but they're a result of choices that people make and decisions that people make, and that things can be changed. So let them make choices. Let them choose what they want to wear to school, in the day, or let them choose between a peanut butter sandwich or a ham sandwich. Let them make their own decisions, or start doing that. The third thing is you want to teach by example. You want to model the behavior that you want to see. When you make a mistake or when you're frustrated, let them hear you say, this is really hard, but I'm going to get through this. Or, I messed this up, but I'm going to keep working at it and make it right. Or, I'm not sure how to do this. I'm going to read those instructions again so I can figure this out. Model the behavior that you want to see in your child. Tell them stories about how you had difficulties, but you persevered, and how you got through that problem. The final thing is to create a positive, nurturing home environment. Finally, the one thing I want you to remember is help is one call away. If you are living in a home where there's a lot of stress or substance abuse, domestic violence, seek help for yourself or for your child. And I've listed some numbers here that you can find help. That could be resources for you. And also remember, your school counselor, your school social worker, and your school psychologist are also wonderful resources for you, and they can always point you in the direction of help if needed.
Valerie, so many of the resilience skills that you talked about are things that we have really been here at Mills pushing with our growth mindset curriculum. So it's so nice to hear that hopefully, some of the skills that we're hoping to teach our students here at school are things that you can also be doing at home. I think it's really important defining trauma. I know that when I think of trauma, we think of those big, heavy hitters. But I was looking at the ACEs, and number 4, how often do you feel that no one in your family loved or thought you were important or special? And I think that really speaks to, it's how the child perceives what's going on. So trauma doesn't have to be some big negative event. It's really about how you perceive something to happen. The death of a pet can be very traumatic, or a loss of a close family member. It doesn't have to be something that we as adults think of as that trauma. So I think that's really important.
Exactly. Thank you for bringing that up. And again, the things that people typically think of as trauma are those big ones, the physical and sexual abuse and neglect. But we often forget about the loss of a loved one, and that could be a pet. And also divorce is also another source of trauma, and so many children experience that as well. And you're right, we just need to be in tune with our children and let them know that we love them and give that reassurance and that home environment that's nurturing and caring and encouraging to them.
And teach them those resiliency skills. I love that.
Exactly.
Thank you so much for joining us
Thanks
today.
for having me.
And we will see you all next month.